Should I get a chin implant or filler?
Chin augmentation can be a very successful procedure for people who want more projection for their chin. It can also result in a more contoured facial profile, achieve a more chiseled look, or extend or better define the jawline. Chin augmentation can be done with a cosmetic filler, a surgical implant, or a combination of both. I'll discuss how I counsel my patients to help them make the best choice for their situation. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. For many years, facial implants, such as chin implants, have been a big part of my practice. More recently, I've been using an advanced filler placement technique to enhance facial structure at the bone level, which has become a significant non-surgical approach to chin augmentation. When it comes to chin augmentation, my patients will express wanting something that is safe, long-lasting, with immediate results, and minimal to no downtime. Before choosing a solution, I first make an assessment. I look at the relationship of the chin projection with other parts of the face, such as the nasal base and the lips from a side view. I measure these relationships using established facial references such as Steiner's lines, Ricketts lines, and the Frankfurt plane. I also use the golden ratio, which is a natural proportion of beauty using the ratio of 1.6 to 1 that we are intrinsically drawn to as it occurs throughout nature. When a patient is looking for a long-term solution, I discuss chin implant surgery. Chin implant surgery involves placing a silicone implant on top of the bone. I typically do this procedure using an incision which is placed just below and just behind the chin that heals very well and typically is barely detectable. This is a fairly straightforward procedure done in our operating facility using local anesthesia with light IV sedation. The advantages of chin implants is that they are long-lasting. It's commonly assumed that implants are permanent. However, the shape and size of the face does change with age as bone, muscle, and soft tissue of the face gradually diminishes. Disadvantages of chin implants for the purpose of chin augmentation are the same as any implant surgery. The implant can shift, can become infected, or need to be removed if the patient chooses to do so because of dissatisfaction with the outcome, requiring additional surgery. I've found that a significant percentage of patients who want chin enhancement are not comfortable with having an implant. This is where the modern and longer-lasting fillers provides my patients a more attractive option. Cosmetic filler placements can be done in an exam room without surgery and still get comparable results as a chin implant. I would also add that the control I have with the precise placement of volume allows me even better results. Technique is critical to successful outcome. I use a technique to place filler in the chin called structural volumizing. Comparable to the approach of using an implant, I place the filler on top of the bone structure. I use thicker and longer lasting fillers such as Juvederm Ultra Plus or Juvederm Voluma. I perform this procedure using blunt cannulas instead of needles as this technique creates less trauma to the skin, soft tissue, and muscle. We can achieve results comparable to chin implant surgery with a procedure that is performed in minutes, with patients usually returning to work the same day or the next day. Initial results can be seen immediately after the procedure, and the material settles over several days. I usually see patients in follow-up after 2 weeks to review their results and compare before and afters, as well as assess if enhancement would be beneficial. Results from placement of long-lasting fillers can range from 1 to 2 years. Should any issue occur which requires removal of filler as opposed to surgery, the hyaluronic acid filler may be dissolved in minutes with the enzyme hyaluronidase. Hyaluronic acid, the substance that makes up the fillers I prefer to use, including Juvederm Ultra Plus and Juvederm Voluma, occurs naturally in the body, so these fillers are safely metabolized by the body with time. The choice of filler or implants for chin augmentation comes down to understanding your priorities. In my practice, I've seen a trend for more than 20 years toward a preference for minimally invasive and minimal downtime procedures, whether the procedure is surgical or non-surgical. I find that the acceptance of filler placement over surgical implant to be the basis for continuous growth in structural volumizing for chin enhancement in my practice. Thanks to the introduction of thicker, long-lasting fillers with the application of minimally traumatic techniques for filler placement at the bone level, I find that I'm more inclined to recommend filler for chin enhancement. I find that the ability to make micro adjustments at different levels from the bone outwards allows me a type of control that cannot be achieved with an implant. Oftentimes, patients also choose to have volume enhancement in other areas, such as the cheeks and the lips, to create even better facial harmony and balance. I hope you found this information helpful. Thank you for your question.